Every day in the United States, 11,000 Americans turn 65 years old. The average lifespan has increased by 10% over the past 50 years, which means more and more seniors are living longer. With the advancement in home health care, seniors now feel empowered to age comfortably in their own home.
In America today, we have 71 million baby boomers. And by the year 2030, that 71 million baby boomers are all going to be turning 65. And that's a large chunk of our population, about 21%. Our seniors want to age in place. It's familiar, it's comfortable for them, and it's the lowest cost healthcare setting that they can be in. 80% of our senior population has at least one medical condition that they need care for, and 77% have 2 or more medical conditions that they need care for. And of our seniors, 40% of them will need help due to some sort of disability at home. It could be vision, hearing, cognition, dressing, and then that's where home care and home health services come into place.
Research has shown, and research recently completed by the Institute of Healthcare has shown that patients age 65 and older prefer to stay at home. It's a familiar surrounding for them. There is something that they refer to as a traumatic transfer, which is when an elderly person is moved out of familiar surroundings into a facility or an assisted living, and they experience anxiety, depression, and then that begins to lead to further decline of the patient.
So home health care is a large umbrella. It covers a lot of different services, something as simple as companion care, where maybe someone just shouldn't be by themselves. Maybe they need help cooking or cleaning or laundry, housekeeping, all the way up to more skilled services such as nursing, physical therapy, occupational and speech therapy, medical social worker, and home health aid services.
If somebody wants to start a home care agency, they should reach out to a consultant that is familiar with all the state and federal regulations and help them through the licensure process, which at 21st Century Healthcare Consultants, that's what we do for probably about 650 different agencies a year to help them get started. So we help them get through the licensing and accreditation process, and we also help train them on policies and procedures, operational processes that they need to follow, their sales, marketing, business finance, business management, all aspects of how to successfully run a business.
21st Century Healthcare Consultants is a home care consulting company. They have expertise in launching home health care agencies. They help you get licensed and accredited so you can provide exceptional care. If you are considering the establishment of a home health care agency, do it with a national home health care consulting company like 21st Century Healthcare Consultants.
21st Century Healthcare Consultants has been in business for close to 3 decades, and we've probably helped over 8,000 agencies through the startup phase of their business. And those are entrepreneurs or caregivers, nurses, clinicians, family members, somebody who's been connected by the industry and wants to start their own agency. And what we do is we help them get licensed and accredited, and we teach them their policies, procedures, all operational aspects of their business, and extensive training on sales, marketing, business finance, business management, and how to develop their referral base. We help about 650 existing agencies a year with their ongoing operations to help them with clinical support, clinical training, operational support and training, sales, marketing training, strategic planning, other business functions that they may not have the skill set or the experience with. And we also have our third kind of main business line, which is Nexen, our compliance platform. It's a software online system that we provide to agencies that has their policies, procedure manuals, and it can have online training for their clinicians to make sure that they're most current with the policies.
21st Century Healthcare Consultants began back in 1996 by a nurse named Rosina McFadden, who was a bachelor's and master's degree nurse. She was a pioneer, very forward-thinking in the home care industry. Since 21st Century began, there have been many entrepreneurs and caregivers looking to realize their dream of owning a home care agency. So we offer business development, licensing, credentialing, and clinical consulting to help agencies not only start, but also thrive in this environment. And since we started, we've helped over 8,000 agencies begin.
Through the many years that we've worked with 21st Century, we have seen positive impact in not only the agencies that they work with, but the patients that these agencies serve. So having that support system in place to where an agency can reach out to one of the consultants with questions and receive the answers that they need, whether it's something related to policy, something related to a new regulation that's coming out from CMS, but just having that support to their customers to ensure that that high quality care is being able to be delivered from the agencies all the way down to the patients that they serve.
In the future of 21st Century Healthcare Consultants, we intend to make an extraordinary impact with our platform by partnering with healthcare partners across the country, by designing a solution that's innovative and it helps solve some of the biggest problems they're dealing with, by helping them with recruiting, onboarding, their compliance, ongoing upskilling of their staff so they feel more confident and more competent to provide extraordinary care for their patients. And the end result is what we hope to drive is improved patient outcomes as well as their experiences.
To learn more about 21st Century Healthcare Consultants, visit homehealthcareconsultants.com.